I'm Dr. Vyas, and I have a gentleman here who desires to have a cosmetic rhinoplasty done. And essentially, he desires to have correction of the depression, or what we call as a saddle nose deformity. So he wants to have this depression corrected. He also has depression just above the nasal alar margin on both sides, and he wants to have those two depressions corrected. And thirdly, what he desires, he wants to have slight narrowing of his nostrils, base. So base of the nostril will be narrowed. My operative plan is, if I can harvest enough septal cartilage, or the cartilage from the septum, then I will use that to augment the dorsum of the nose and use some of that cartilage, crush it or bruise it to augment the depressions and correct the depression on both sides of the nostrils. And thirdly, he already had some VR excision done at the nasal alar base. What I plan to do is essentially advance the nasal alar base and cinch it in the midline, towards the midline, to reduce the width of the nasal alar base. For the alternative that I have for the dorsal augmentation is I can use the conchal cartilage, dice it, and use in continuity either a post-auricular facial flap and roll this diced cartilage and augment the dorsum of the nose, or dice the cartilage, harvest the temporal fascia and augment the diced cartilage wrapped up in temporal fascia over the dorsum of the nose. That's the operative plan. Thank you.